What are the different cervical cancer types? Imagine the cervix as a gateway between the uterus and the vagina. It has two main types of cells that line it: the flat, thin squamous cells on the outside and the glandular cells on the inside. Most cervical cancers start where these two types meet, in a zone called the transformation zone. Understanding the different types helps doctors decide how to treat and manage the disease. The most common type is squamous cell carcinoma, which makes up about 90% of cases. It develops from the flat squamous cells on the outer part of the cervix. These cancers usually begin in the transformation zone, where the squamous cells meet the glandular cells. Because they are so common, screening tests like pap smears are especially good at catching squamous cell carcinomas early. The second main type is adenocarcinoma, which arises from the glandular cells lining the inside of the cervix. These cells produce mucus, and cancers from them tend to develop higher up in the cervical canal. While less common than squamous cell carcinoma, adenocarcinoma accounts for a significant portion of cervical cancers. It can sometimes be harder to detect early because it occurs higher in the cervix and may not show up as clearly on traditional pap tests. The third type is adenosquamous carcinoma, which is a mix of both squamous and glandular cell features. These cancers have characteristics of both main types and are less common. They can be more challenging to treat because they combine features of both types. Besides these main types, there are rare forms of cervical cancer, such as melanoma, sarcoma, and lymphoma, but these are much more typical of other parts of the body and are not considered standard cervical cancers. Most cervical cancers are linked to persistent infection with high-risk types of human papillomavirus, or HPV, which can cause changes in the cells over time. Knowing the type of cervical cancer is important because it influences how the disease grows, spreads, and responds to treatment. Early detection through screening and vaccination against high-risk HPV types can significantly reduce the risk of developing these cancers. If you have concerns or questions about cervical cancer, it's always best to consult with a healthcare professional who can provide personalized advice based on your health history.